Hi guys, so today I'm going to be talking to you about dental hygiene. My name is Sheila Ortiz Castillo. I am a registered dental hygienist. I work at Family First Dental in Wayne, and the dentist I work for is Dr. Knudsen. So what is a dental hygienist? Pretty much the one and only answer I get is all we do is clean teeth, which I mean we definitely do, but we do way more than that. A dental hygienist is a licensed healthcare professional. We provide preventative, educational, and therapeutic services. I'll kind of explain to you a little bit of what each one entails. For preventative services, obviously, definitely important, the hygiene appointments, which is pretty much what everybody knows. We're focusing on removing the plaque biofilm, the calculus tartar buildup, the staining. We want to make sure that's definitely out of there. We don't want that to stay on there because definitely that can cause your gums to be really irritated. And of course, we don't want the bacteria to be on there and cause cavities. So it's really important to remove all of that. And of course, when the dentist comes in and does their exam, we want to make sure that they can fully see all surfaces of the teeth without having the buildup on there. Now, what is plaque? The plaque is kind of pretty much the little white stuff that you can see. You can definitely sometimes feel it too on your teeth. It kind of feels fuzzy. That is the really easy stuff that you can take off with your toothbrush and flossing at home. Of course, the longer that stays on there, it starts to harden to your tooth and calcify, and it turns into that tartar buildup. So that's where I come in with my instruments, and I'm scaling all of that off of there because you can no longer remove it. Another preventative service that we do is sealants. So what they are is you have really deep grooves on your teeth, and at times the plaque gets really down underneath there and the toothbrush can't clean it well. So doing the sealants is kind of doing kind of a coating on the top of the tooth, kind of covering the grooves to reduce your risk for developing cavities. Usually the sealants are done on younger kids, kind of when their molars are coming in. Fluoride is another preventative services that we offer. Definitely offer it to all of my patients because it's really good. It kind of just helps remineralize your teeth, and it definitely helps remove or helps reduce the risk for developing cavities. So we definitely always recommend it for everybody. So those are just kind of examples of what preventative services are. Educational services. So here I'm definitely focusing with patients on how to brush, floss, what they need to be doing at home. I only see patients 2 times a year, every 6 months. So it's really important for me to let the patient know exactly what they need to be doing at home, where in their mouth they need to be focusing on to make sure that they're doing what they can at home to clean as best as they can.
So in addition to the educational services, like I said, I talk to my patients about what they need to be doing at home. So we just kind of go over what's best for them, whether they can be using a power toothbrush, a manual toothbrush, different types of floss. It can be like the little plackers, the string floss. This is kind of more of a longer handle to be able to floss towards your back molars. I always go over like if they need to be cleaning their tongue cleaner here. So I just kind of adapt for each patient to make sure that they use the correct things in order to clean their teeth. Of course, here we have like patients who have braces. This is kind of a floss threader, so it helps clean around there. And then the little brushes that they can also be using to clean around the brackets. Now, instruments that I use during the appointments, we have the mirror here. We have these 2 are explorers, so these help me detect kind of where you have tartar buildup. They help the dentist detect like for areas that could be turning into cavities or stuff like that. Now, another main thing that I was focusing on was the gums. So this instrument here, a probe, it helps me measure your gums and it kind of lets me know how healthy they are. So this is one of my best instruments that I can use. Other stuff here, I kind of have like the scalers. So the different types of instruments that I use to be able to clean the tartar effectively. And then we have extra additional stuff too. So this is just kind of what is usually on my desk when I am with the patient.
So we kind of just go over which one is the best toothbrush, whether it's like a manual or a power toothbrush, if they like using the string floss or the little plackers. So it's a lot of little things that I come up with so that they can kind of take a game plan home and be able to use it too. Now for therapeutic services, here we provide kind of a periodontal therapy. So it's called scaling and root cleaning, and what it is, pretty much everybody knows it as the deeper cleaning. So what this is this picture kind of shows a good example. We want for your gums to be firmly attached to your teeth. We want your gums to be nice, pink, and healthy. The more plaque that gets down underneath your gums get really irritated, and that bacteria just start causing your gums to get puffy and kind of detach from the root of the tooth. So we definitely don't want that. Once it gets to that point, then I am going in with a different set of instruments, cleaning all of that out of there. We don't want it to keep getting any worse. Usually for patients that have had the scaling and replaning, we usually see them every 3 months, just kind of make sure how they're keeping up at home with brushing and flossing, and kind of just keep removing all that buildup, because once they're in this point, we don't want it to get any worse. So it's kind of just about preventing from it getting to a really, really severe point. So those are kind of some examples of what therapeutic, preventative, and educational services are. We also take radiographs or x-rays. The x-rays really help me see where the buildup is at. You can kind of see on the x-ray kind of the little spikes that the teeth have, so that lets me know where I need to focus on for removing the buildup. We can use it to check your bone level, and of course the dentist uses the x-rays to be able to fully diagnose if you have a cavity or if you're starting to lose some minerals. So they're really nice to have, and it kind of just helps us be a little bit more effective with the cleanings and the exam. Now, I work with many different types of age groups, which is fun, because sometimes I get the really excited little kid that comes in, super excited to get their teeth clean. Then I get the really nervous little kid. So it's just kind of, you adapt the appointment for each patient. I work with college kids. I have patients that are older, and it's nice to kind of have a variety so that it doesn't make the day boring just seeing the same age group. Now, like I said previously, we definitely want to clean your teeth, but not just that. We want to make sure your gums are healthy. I kind of just check them out, see how they're doing. I have different instruments that kind of help me measure how firmly attached your gums are to your teeth. And so that definitely lets me know how healthy they are. And, the picture, kind of the same one as the previous one for the the scaling and replaning. One side showing really nice healthy gums, the other side showing really irritated gums. So every single time a patient's coming in, I'm checking their gums out too, and kind of just letting them know where they need to focus on, or kind of what state their gums are at. Another thing that we do is oral cancer screenings. So we definitely want to make sure that we're doing this too. We kind of check for signs of oral cancer. We're checking the lips, the cheeks, the tongue, kind of everywhere in your mouth. We want to make sure everything's doing okay. If we do find something, if the dentist finds something, they kind of just refer you on to get biopsied and kind of go from there. So this is a really important part of your appointment too. Now, in the state of Nebraska, I can do local anesthesia, so that's pretty much where I'm numbing patients up, which is really nice. So with this, we can go back to the slide where I talked to you about the scaling and replaning. So it's really nice to be able to numb up my patient, and that way they're comfortable and I can do my job effectively without worrying about, hurting them or anything, or if they're feeling anything. So it's really nice. I don't have to wait for the dentist to come in and numb up my patient. I can do it. And then at times too, when the dentist is running behind, it's nice to be able to numb up their patient too, to be a little bit more effective with time. Like I said, in the state of Nebraska, we can do it. It just kind of varies on what state you're in. So you kind of have to make sure you're aware of that too. Now, how does one become a dental hygienist? Definitely take your 2 years of prereqs after high school, and make sure you're kind of keeping up with the requisites that you need to do in order to apply for the hygiene program. Once you've done everything you need, then you apply, and you can go. I know there's a program here, UNMC in Lincoln. They offer your bachelor's. I went to the University of South Dakota in Vermilion, and I got my bachelor's in dental hygiene there. There's some programs that offer the associates too, but it's really nice to kind of get it done and over with and get your bachelor's too. So you just kind of make sure you do your research, and you need to do what you need in order to apply. Once you're in the hygiene program, the first year is kind of a lot of book stuff, so they just kind of want to make sure you understand, kind of get a baseline of hygiene, and then it's really exciting when you kind of have that down and you can start working on patients. So you have a lot of the professors that are helping you out there too, so it's a lot of hands-on, and it's really fun. Now, once you've taken the 2 years of dental hygiene, then you take your written exam and you also take a clinical exam. You need to take these in order to be able to graduate, or pretty much in order to be able to become a registered dental hygienist. So these are really important exams that you need to do. Once you've passed those, then you can go ahead and apply for your state license. Like I said before with the local anesthesia, every state is different, so you want to make sure that you're understanding what your state needs you to do. Here in the state of Nebraska, you apply, there's a fee you have to pay, but every odd year you have to renew it. It's not just a one-time thing. You have to keep renewing it. And how do you do that? You take 30 credit hours, which are pretty much continuing education courses. You don't just get your license and that's it, you're done. You definitely have to keep up with the technology. You know, dentistry is changing, so you want to make sure that you're always keeping up with the latest things. So it's nice to be able to do that too every 2 years. And it's really fun going to classes and kind of learning. You can do online classes, you can go in person, and there's like some magazines too that offer you some continuing education credits there too. So it's nice to be able to have a different variety of where you can get those educational hours. Now, salary, this just definitely depends to what state you're at and where in the state you're at. So average for Nebraska is usually around $64,580. Hourly, it's about $31.50. It just kind of depends, like I said. Now, for me, I speak English and Spanish, which is really nice. So that's kind of a plus. I am definitely thankful I can speak English and Spanish, because you can talk to the patients, you know, in a language that they are comfortable and that they fully understand what they need to have done, or, you know, stuff like that during their appointments at the dental office. So it's really nice. Now, why did I choose dental hygiene? I chose it because I just really enjoy helping out people. Like I said, every day is not the same. You're essentially doing the same. I mean, you're cleaning teeth, but it's a different patient. Like you have, you know, like I said, different age groups, you know, whether I'm speaking English or Spanish, it's just really fun. It's never boring, and every hour is different. So I really enjoy it. Thank you for taking the time to listen to my PowerPoint. Fun fact, October is National Dental Hygiene Month, so it's really nice that we get to bring awareness to that. So I hope you guys enjoyed it. Thank you.